Hi, it's Dr. Amy with Amethyst Wellness. I'm here with Jerry, and today we're going to talk about bioidentical hormone optimization using the BioTe method. Okay, so something this small can make such a big difference. These are BioTe pellets. They're about the size of a grain of rice, and I will say that 90% of my patients find it life-changing. They love their hormones, and we're going to tell you why.
Absolutely. Very few things that we do that we get this much positive response from.
So what are hormones? Do we get older because we lose our hormones, or do we lose our hormones because we get older? Hormones are chemical messengers that are made by the endocrine glands, and they control certain things and certain actions of your cells and organs. They work at a lock and key fashion, so the hormones is a signal. It says to the organ, hey, do this. And what happens as we get older, the organs don't listen so well anymore. So how do you feel? Like this? Right now we all feel like this, right? or like this. That's how we feel at the end of the self-isolation, right? Or do you feel like this? And of course, this is how we all want to feel.
Right. Absolutely. There's in the new anti-aging medicine, they start to look at aging as a disease process, actually. And it's not people who want to live forever. It's people who want the most quality from the time that they have here.
Right, so aging healthier. And yeah, nobody wants to get old and just suffer and have disease, but if
Right.
we can feel good as we get older, then that's key. Okay, any of these things sound familiar? Fatigue, mood swings, anxiety, tension, irritability, lack of sleep. A lot of people, as they become hormone deficient, wake up really early in the morning.
Irregular
They're sleeping well.
Yeah.
Some memory loss, depression, brain fog is a big one we hear a lot. And of course, the classic menopausal symptoms of hot flashes and night sweats, weight gain, and pain, and it goes on and on.
It's funny they mentioned joint pain. When folks, it's a lot of people, when they come back for their pellets, the way that they know that it's time to get new pellets is their joints start to ache again. So very effective against arthritic joint type pains.
Right, and then that bullet you might not be able to see is decreased sex drive. That's something we hear quite a bit. And I think pellet therapy is saving marriages.
Mm-hmm.
Okay, so the point of this slide, the #1 killer of women is heart disease. And that gets worse as we get older. So once a woman hits postmenopause, or when she becomes menopausal, her risk is 1 in 3 of having heart disease. So the good news is, before we get to that, the good news is the bioidentical hormone optimization actually protects the heart and helps prevent heart disease. And we'll get to all the great things that hormones do in just a minute. So a lot of my clients aren't yet menopausal, but they're perimenopausal. So this is that vague period of time before the ovaries stop working completely, but they start to kind of get tired and mess around a little bit. So it means around menopause, so the woman's body is making its natural transition toward permanent infertility. That's a great phrase.
Mm-hmm.
Love that. But a lot of women, and I'm in this category myself, I use bioidentical hormone replacement to treat my perimenopausal symptoms, which will help me to transition more gracefully. And then menopause. The definition, menopause is what happens 12 months after you stop having a period. It can happen in your 40s or 50s. The average age is 51. I've seen a huge gamut of when this happens to a woman.
Mm-hmm. Could be as early as mid-30s, right?
Right, which is not typical, but I have seen it. And pellet therapy can help those women especially.
But certainly perimenopause too.
Absolutely.
Yeah.
So facts about menopause. 3,500 women enter menopause every single day, and the symptoms start up to 15 years before, and we just see quite a bit of that. Some women say they get over it. I went through menopause. But here's the thing, there are so many health issues that occur when we're hormonally deficient that we don't get over it. We may stop having symptoms, but our health is being damaged when we don't have proper hormones. Okay, so we mentioned a little bit about bioidentical hormones protecting the heart, but it also can help protect the brain. It can prevent dementia, Alzheimer's, which is a huge concern for a lot of people. It can reverse osteoporosis. We have seen that. And it can protect the breast. Bioidentical hormones do not cause cancer, and they actually can be quite protective. And I think the reason there's a lot of confusion on that is because traditional synthetic hormones can be quite harmful. They can cause cancer. They can cause blood clots and heart disease. But so a lot of people don't make that distinction. They say hormones are bad, and that's not true. Bioidentical hormones can be quite helpful.
So they say protective by optimizing your hormones, your brain, your heart, your bones, and sexual function, libido, can all benefit. And some of these things you can see with the pellets, but some of them are actually just health benefits that in the past have gone along with aging. Now we're looking at healthy aging.
So I call these the behind the scenes benefits. So people come to us because they don't feel good, right? Especially a woman in menopause is having hot flashes, she's miserable. That's why they start. But we also know it's promoting health. And so it's very gratifying for us to provide this treatment.
And when you look at things like breast cancer, there are actually some oncologists who use testosterone pellets surrounding the tumor to help shrink the tumors.
Which is pretty cool.
Yeah.
Okay, so estrogen, estradiol in our bioidentical form, it's present in women and men. Of course, men have it just a little bit, and women have much more. And it has over 400 functions in the body. And, it controls hot flashes, so that's a lot of times the first symptom that really becomes apparent to a woman as she doesn't have it anymore. But skin health is very important. When we lose our estrogen, our skin gets thinner and drier, we look older. So it's actually part of an anti-aging regimen is replacing estradiol as well. And it increases your feel-good hormones, your serotonin. So it's really vital. I have women come in and they just start crying. I hear the same story, and they said, I was told I was normal, and they tears, and they feel horrible. So when we do the BioTe method, we're actually looking at optimal levels of hormones. So you may be normal, but you don't feel normal. So we can look at it a little differently and get you optimal so that you do feel your best.
I know working for years in traditional medicine, if somebody came in and they said, hey, I'm depressed, well, they got antidepressants, something along those lines. But this is a new way of handling a problem, working on problems upstream, trying to figure out what's the root cause instead of just putting a patch over a symptom.
Right. And I've even had some of my clients get off of their antidepressants once their hormones are optimized,
Absolutely.
which is awesome. They get off some of their sleeping medicines too.
Right.
Okay, andropause. That's what happens to men when they lose their testosterone. Menopause. Okay, so 20% of males over 50 have low testosterone, and we're seeing that in even younger guys. A lot of young men who are suffering from depression also have low T, and just fixing their testosterone is life-changing. So we're seeing that more and more, and whether it's environment or...
Well, and I'm seeing it in people. There are people who, for weightlifting, for one reason or another, were abusing in the past different steroids. I'm also seeing it in a lot of folks who were on OxyContin or hydrocodone or other narcotics tend to have lower T.
Right, so the pill epidemic that we're hopefully coming out of is actually having long-term consequences for
in younger men.
Yeah. So low T is not only associated with feeling bad, right? So feeling tired, gaining weight, but it's also linked to heart disease, diabetes, overall increase in mortality. So it's really, really important to optimize testosterone. Okay, so testosterone protects the bones. It protects the brain, the breast, and the heart. And I know we talked about that. And relationships. Definitely couples are finding that they're reconnecting once their hormones are optimized. Women start to lose testosterone because we need it too. We start to lose it sometimes in our 20s, 30s definitely. So we do have some younger women come in here who aren't feeling well, and we can optimize their testosterone and get them feeling better. Okay, so this slide it just helps explain why men, when they have low T, are at increased risk of disease. So when we optimize testosterone in a man, we get you to be on this upper level, to be between 900 and 1100. And that number is based on research that shows that it can actually protect against all these things. Okay, so women have low testosterone too, and so women with low T are at increased risk for Alzheimer's, heart disease, fractures. As women get older, that becomes a huge concern. Their bone health. Increased risk for diabetes when your T is low, and then possibly breast cancer.
I've actually seen hemoglobin A1Cs go from 10% down to 7% in people that I've pelleted. So certainly metabolic syndrome is something that's testosterone.
So a big improvement in diabetes. Yeah. Okay, so positive effects of natural, so bioidentical testosterone. So that means this is the exact same chemical structure of what your body used to make, but stops making. So we talked about energy and vitality, improved feeling of overall well-being, improvement in depression, memory, focus, libido. I've seen it lower cholesterol levels. So bioidentical testosterone actually lowers cholesterol, doesn't raise it. Like synthetic testosterone can raise cholesterol,
including cypionate.
Okay, so cypionate is what some traditional practitioners are prescribing for men with low T, and insurance covers it, right? But it's actually can be quite harmful. So we recommend this method.
Just for time's sake, we're going to keep going.
Okay, so we're going to just talk for a minute about the method of hormone replacement. So BioTe is a pellet form of hormone. So what that means, you saw on the first slide or the second slide, it's about the size of a grain of rice. It's a tiny little pellet that's inserted into the fat tissue in the hip. And what this allows for is continuous release of hormones. And your hormones like to be at a steady state. When our hormones go up and down, that can cause a lot of problems. And these other methods, the cypionate that you were just talking about.
Absolutely. Yeah. So it throws you way up and then it crashes you back down.
Yeah.
And that's not the way the body's supposed to be. Pellets are the only ones that work on cardiac output. And so you exercise more, you get more testosterone. You're more sedentary, you get less testosterone.
Right. Okay, so this is the end of part 1 of our discussion on bioidentical hormone pellets. Stay tuned for our next video of bioidentical hormone replacement part 2, and we'll finish our discussion. Okay, thank you.